Thank you for joining us for this MCP vaccination education session. And as I said, a lot of it may be things you already know. It might be a review, and you may learn something. At the end, if you think of any questions, just write them down during the presentation, and we'll be able to answer your questions at the end of the presentation slideshow. Okay, my name is Colleen Hagan. I'm the Director of Care Coordination on the South Bay, and my background is actually in science. I used to diagnose cancer. I worked for Mass General Hospital before, making a change over to home care. So today is March 31st. So we're going to give you a little update on COVID-19. So, everyone's aware it's been over a year. COVID's been present. And I just wanted to give you some statistics to show like its power, its impact. Worldwide, we've had 2.8 million deaths, 126 million infected. Right. In the United States, we've had about a quarter of those are from us, right? We have 31 million infected and 600,000 deaths. And in California alone, and we're a big state, we've had 58,000 deaths around and 3.7 million infected. And this number is still growing. Yesterday it was 116 tested positive. So even though we're having this vaccine rollout and more people, people are taking precautions with masking and all that, we are still seeing numbers in our area and across the United States and world. The most concerning are what's called the new variants. And to be a little technical, like the virus, if you think of it as a globe with some spikes on the outside, that is the virus. But with the new variants, they have so many more spikes on the outside, right? So they're just really highly contagious. If you do get this variant, you're more likely to be hospitalized. And this is part of what is the main concern going forward in 2021 through into winter, right? So they're forecasting that we're going to have issues into winter with this. Some of the symptoms you already know. The mild symptoms, you feel like you're just got the flu, or you have a fever, headache, maybe nausea. The loss of taste and smell is really unique to this virus. And so that's one thing they do ask you when you're going over symptoms, calling the doctor. They'll ask if you've lost a sense of taste or smell. The mid-level symptoms are those that are really hard for you. You're having trouble breathing, you're having trouble walking, you're so tired. And you may have like your respiratory system may be compromised to the point where it's a really big struggle, but you still are not able to be hospitalized. Like they'll still send you home during this period. And the more severe symptoms, and because it is a vascular disease, meaning it does attack the vascular system too, possible stroke, seizure, organ failure. That's when you've been ill for so long that your kidneys are starting to give out, liver. You'll be intubated, meaning that you'll have someone helping you breathe, a machine, and then death is the most severe symptom. Right. Now, we do have some chronic symptoms. So the long haulers, they're people who have been sick. They tested positive for COVID. They were sick. They are not fully recovered even months later. They even may feel better for a short period of time and then relapse. And what's really interesting is that they no longer test positive for COVID, but yet they are feeling all the symptoms of COVID. Right. So the ones that are the most concerning, that are long lasting, is really chronic fatigue, chronic headaches. And this means just long lasting, not giving a break. Right. You're always tired. You always have a headache. Chest pain and breathing difficulties can continue. And something called brain fog. You can be really confused for a very, very long time following the initial symptoms. So the most vulnerable to COVID-19 are obviously our clients, right? They fall into that vulnerable group where they're elderly, they may have underlying medical conditions, right? But those are the most vulnerable. And you're on the front line, working with them. So I really appreciate what you've been doing for your clients. Now, who is the most likely to infect a client? So we've had a lot of protocols, and we're not taking clients out, and we're using masking and good hand sanitizing. So really, it would be us coming into the home, or a family member, someone coming into the home is more likely to be that source of transmission. So how do we protect our clients? So we have a COVID protocol, right? If you have a fever, you're staying home. If you're ill or exposed or have a COVID positive, obviously you're isolating. When you're in the home, it's you want to have proper hand hygiene. You want to help your client have proper hand hygiene. You're sanitizing the surfaces every 2 hours, and most importantly, you're wearing that K95 or N95 mask at all times when you're working with the client. Um, and then the last thing that you could do to protect them is to have a COVID-19 vaccination, or the client also has a COVID-19 vaccination. That's the best way to prevent. Um, so how this vaccine works, again, it's a little technical. This is an mRNA vaccine, right? It utilizes just a part of the virus to stimulate the response. It's not the whole virus. When injected, the vaccine will stimulate your body to produce antibodies, and these antibodies will remain in your body. So that if you do get a COVID 19 infection, as soon as that virus is detected, those antibodies are going to target it and neutralize it, right? Some of the common vaccine side effects, and I don't know how many of you have had it. I've had it. I've been lucky to have it. My first side effect, I didn't feel anything. I just felt a little pain in the at the site. But the second dose is a larger dose. The first one is a booster. So the common vaccine side effects for the second one, I would say, is fever, body ache, headache, pain at the site is common, but these are short-lived. It's under 48 hours, and most people, it's a 1 day side effect, right? And again, this is just the immune response. It's your body responding to this vaccine, showing that it's working, but it is not a COVID-19 vaccine. It's just your body's response. In terms of vaccine safety, so for anything to be approved by the FDA, even for an emergency, it does have to go through a certain safety standard. They tested it on over 65,000 people across diverse groups. They want to make sure it's safe for all. And the thing with this is, even though they've tested it prior to the first vaccine being given, data is being collected to make sure that they're keeping an eye on the safety, right? Moderna and Pfizer are the two most common. They have the two doses, and Johnson Johnson has been currently and FDA approved as well, and that's a 1 dose. For the effectiveness, so Moderna and Pfizer vaccines are 95% effective at preventing COVID-19 cases with mild or mid-level, meaning you won't have that. You won't get the lower levels of symptoms if you do contract it, right? You may get it, but you won't get sick from it. It's 95% effective. Because of the variants, however, there's that 5% that you could still uh, get sick. Now, 100% it's effective of keeping you out of the hospital, right? So even if you were to get it and you're in that 5% who may get COVID-19, you're not going to end up in the hospital because it's 100% effective at preventing cases with the very severe symptoms. Can I get COVID? These are some of the questions we get. Can I get COVID-19 infection from a vaccine? No. Can I test positive after receiving the vaccine? No, not from the vaccine. None of the FDA approved vaccines utilize the live virus that can cause COVID-19. So you will not get the infection from the vaccine, and you will not test positive. But you are not fully immune. So even though you've had Moderna the first shot, and then at the end of the month you get the second shot, it's 2 weeks later where your immune response, all the antibodies have been produced. So you still want to be really cautious about wearing a mask, good hand hygiene, all of that after having your vaccine until you're 2 weeks out. Does Tender Rose require MCPs vaccinated? You've heard us talking about it, and people think that we're trying to enforce this. No, we are really only trying to encourage it, right? We're not mandating it, it's not mandated. Um, but current and potential clients are increasingly asking for vaccinated MCPs. So our current clients are calling and talking schedulers, who's vaccinated, who can come to us, right? New cases are asking right away, like, are your employees vaccinated? So that is a concern. Now, why should I be vaccinated? Now, the most important for our clients is that they're vaccinated, right? And some of our clients can't. They can't leave the house yet, that sort of thing. But for us, why we should be vaccinated and why I was vaccinated was that I care about my health. I want to stay healthy and I want my family to stay healthy. I also care about my community health. I'm out there wearing a mask. I'm making sure I'm socially distancing. I'm doing everything I can to make sure that, I'm not a risk to other people, right? My clients' health, right? I go into people's houses, into my clients' health. I want to make sure that I'm healthy and keeping them healthy. And then lastly, the reason why we should be vaccinated, I think, is because the clients and the families are starting to ask. It's not going to go away. So we have some really good statistics for Tender Rose, but I want to go over first worldwide, US, California, and then get to us, okay? So 552 million doses worldwide have been given. 140, that's worldwide, 143 million doses in the United States of America. And Biden has said that everyone should be eligible for it very soon, but that we want to have, what's the word, the supply, even though it's saying that yes, everyone will be able to be vaccinated, supplies are needing to catch up. 17.7 million doses have been given in California. That's really excellent. Now, 79% of our Tender Rose MCPs are currently vaccinated or in the process, meaning they've had one dose at least, and some of them have completed and gotten 2 doses. 88% of our clients have been vaccinated. Again, the ones who haven't are generally bedbound. They're not able to leave the house, and currently we can't. There's no way to get the virus to them because it needs to be refrigerated. It actually has to be below 0 degrees. And then 79% of our TR office staff have also been vaccinated. So, we're really on board. I'm really thankful that I was able to get it. It's a big relief for me. And I'm really anxious to be able to have my children get vaccinated as well. All righty. Oh, there we go. All right. Did I stop sharing or am I sharing?
I think you're still sharing.
All right.
Here we are.
Technology.
That was great, Colleen. Thank you so much.
You're welcome.
Yeah, thank you, Colleen. That was really great.
Yeah, thanks. And we're here to answer any questions. I don't know who's here. Let's see, we have Ashraf and we have a few people. So if you have a question, you can unmute and just ask. And if no one has questions, I can ask my panel maybe to say something. Yes, do you have a question? Does anyone, Tenzin?
I have a question for MCPs who haven't been vaccinated yet, but who are interested in doing so. Is that something that the office that Tender Rose can help them register for?
If they call the office, we can definitely help them figure out where they can go. It's how I did it is I went through my county. So I went to the county website and then was able to get to my vaccination. A lot of like My Health for Stanford, if you have the My Health app, or if you're with Kaiser, you can go through your app for that medical facility and sign up now. It's a lot easier now than it was previously. So my daughter's 18. She was told she can now go through My Health to sign up.
Oh, wow, that's great.
But if you're unable, you can definitely call the office, and we're here to help, just like we've helped with getting everyone in for their COVID test. Yeah. Natalie, do you have a question or do you have something you'd like to share? No pressure.
No, I'm not sure. I guess I will just share like my experience. I was one of those that was really on edge about getting vaccinated. But as Colleen said, you really have to sit back and think about yourselves, your families, your clients. And just really, I think the biggest worry for everyone is the potential side effects. And what I can share with you, just my experience with it, is if you go in just knowing that, hey, I may not feel good tomorrow. I may have COVID related, or not COVID related, but I might experience some of the things that, people experience with COVID. But if you really get in that mindset of, I'm prepared for this, this is what I'm expecting, it's going to help you a lot. And I can tell you, I got the second vaccine. First one I did fine. The second one I got, first day was fine. That next day I felt like I was hit by a truck, to be honest. But I think what helped me through it is just knowing I got that vaccine. This is what that is. Let me just counteract the symptoms I was having, which was, some body aches and just feeling really, really tired and a little bit of a fever. But I took Tylenol, I stayed on top of it. And I think by that night, so I had my vaccine on a Wednesday, Thursday night, I was up cleaning my bathroom at 9 o'clock. It was like this huge shift of feeling really bad to just feeling like myself again.
Mm-hmm.
And I walked away just feeling like so relieved that, my energy came back up. I wasn't as stressed out. I felt safer. It just brings a lot to you when you're vaccinated. But I understand the concern, but that's just my experience with it, is you just have to go in with the right mindset when you're going to do it, and you will feel so much better afterwards. So.
Thank you. Thank you very much. And then Debbie, do you have anything to say on the science of this? I know that's one of your fortes.
Well, you said it pretty well about the variants. It's been proven that with vaccinations, I can speak for Moderna and for Pfizer, that we're seeing a lot of efficacy in the way that this vaccination is protecting a lot of people from. I do have one question, Colleen. So some counties are opening up vaccinations. For example, Contra Costa is opening up to giving vaccinations for anyone over 16, I believe. For the counties that don't have for the counties that don't have the availability to give out the vaccinations, can I get a letter from Tender Rose to let them know that I am a healthcare worker?
Oh yes, we did that for the when we went, right? We had to bring something that proved that we worked for Tender Rose. So yes, we can definitely do that. If you do find out you need something like this in order to get the vaccine, please, contact the office, and we'll send it to you via email, and you can carry that with you. When I went, I had to show a paycheck work. That was great. And an ID. They didn't ask me for a letter, but because I had a paycheck from Tender Rose on my phone, they allowed that. And then there was one other thing I wanted to talk. So even if they say it's 16 and older, it is based on supply. So you may go, you may make an appointment, and then they're going to tell you to reschedule, but don't give up, because it's usually within the week. And then the same thing with the second dose. They may call you and say, or you may show up and they say, oh, we don't have enough today, but you will get seen within that week. To just follow up with them. Yeah. And then Jim, did you want to say anything about like anything at all about, the extra 8 hours or?
Yeah, I'm going to say a few things, and I really appreciate our NCPs who are on here and our care management team, and Caroline and Amanda. But when I I was really excited to get the vaccine because I just don't want to get this virus, and I'm a lot more worried about the long-term effects of COVID than I am the side effects of the vaccine. And I know people that are considered long haulers, and there are news stories that are coming out that even people who have long-term symptoms after COVID are getting better after they get vaccinated. Like the symptoms are going away for some people, which I think that's pretty exciting. But for me, I was all geared up. Like I know a lot of people who've been vaccinated. I figured after my second dose, I'm going to have these side effects. And so I get my second shot and I'm sitting there about 15 minutes into it. I start to feel a little bit different. I'm like, oh boy, here it comes. I'm going to be out for like 2 weeks. And it literally went away like 5 minutes later. Like and I was just almost disappointed. Like, what happened to the side effects? and so you hear about people with side effects. I had none. I mean, other than just this feeling like, oops, here it comes. And I can tell you, I'm more than 2 weeks past my second dose. I just feel so much more relaxed being in public. I am not worried about getting infected. I mean, I still wear a mask to be polite, but I'm not worried about the person who's got their mask under their nose or coughing in public or whatever. I'm just like, I'm protected. And so it just makes me feel so much better. The one
Like a
other thing I would,
superpower.
yeah, it's kind of like, I feel like I'm past COVID. My family's not. I really want my family to get vaccinated, and they're anxious to get vaccinated. But the one thing I will say is the whole world has been pushing really hard to get as many people vaccinated since pretty much late December through now, right? Today in the US, over 3 million people a day are getting vaccinations. And from December to today, almost every piece of news that comes out about these vaccines is good news. There's almost no bad news. There's one vaccine that's being given in Europe that they worried that maybe it had some side effects causing blood clots. I think even they're deciding that it wasn't really doing that. But between Moderna, Pfizer, and Johnson & Johnson, there's almost nothing but good news for 3.5, 4 months, right? And so this is our way as a country and as a world to get past this thing. And we really encourage MCPs to get vaccinated. We can completely understand if you don't, but one of the things we're going to continue to do is do everything we can to protect our clients, because we have had clients pass away from this virus, and we are the biggest risk to them. And so one of the huge advantages of going ahead and getting vaccinated is we will give you an extra 8 hours of PTO just in case you get those symptoms after your second dose, right? So there's 8 hours of PTO, but we need you to go get vaccinated. We are able to relax our protocols around the safety of our clients because there's strong evidence that once you've been vaccinated and you're 2 weeks past your vaccination, you cannot transmit. I mean, something like the combination of the client being protected and you being protected means the chance that you would actually infect your client if you're both vaccinated is minuscule, right? So what that means is we can relax our testing protocols. You don't have to get tested every week. We're going to get to the point where you don't have to wear a KN95 mask. And I know we're looking to relax our protocols for the benefit of our MCPs as quickly as we can, but we can't do it if you don't get vaccinated. We still have to protect our clients. And so I just want to kind of throw that little plug in there too. But, we are not going to require MCPs to get vaccinated, but it's going to be very, very, literally every single new client we're signing up wants vaccinated MCPs. Most of our existing clients, now that they realize that if you want to get vaccinated, you can get vaccinated, and all of them are getting vaccinated themselves and they're getting their loved ones vaccinated, it will be harder and harder for us to keep MCPs on a schedule if clients are insisting on vaccinated MCPs. And so I think the reality is over time, it will be harder and harder to work in home care without being vaccinated because the clients won't let you in their homes. And that's probably the most compelling reason to get vaccinated. And I think, there's a lot of people who were really anxious to get vaccinated as quickly as possible. There was a really, really big group of people that said, let's just wait and see. Like, I don't want to be first. I want to see if there's any side effects. I want to see if there's any long-term effects. And I would say, there's no guarantee that there's not going to be something learned about long-term side effects of the vaccine. But what we already know is there is strong evidence that there's long-term side effects from getting infected, right? And so I think the way I look at it is the risk of, everybody needs to weigh this risk, right? If you don't get vaccinated, you will eventually get infected by this virus, I believe. Everybody's either going to be vaccinated or infected. And what we're starting to see from the research on people who've been infected and vaccinated is the vaccine actually provides better protection from getting infected in the future than having been infected in the past, right? Like even being infected isn't as good as protection as the vaccine. So just strongly encourage you, if you're thinking about it, like there's probably no better time than now to go ahead and get vaccinated.
Thank you, Jim. That was really helpful. I do want to say that I am a certified phlebotomist, but I do not like needles in my arm. I don't mind doing it to other people. I don't mind giving blood, but as soon as that shot's there, I panic and my heart races and my adrenaline shoots up. And I was really pleased at how they handled it. I let them know ahead of time that I'm a wimp, and they escorted me over to sit down, and everyone has to sit for 15 minutes before leaving to make sure there's no side effects that are related, more like if an allergic reaction sort of. And then once they see you're fine, you're signed off and you can go. So even if you're nervous, you can get through it, and it's really a good benefit. And my daughter's terrified of needles, and I'll be hopefully helping her to get it too. She inherited that from me. So does anyone have any questions? Caroline or Amanda, do you want to share anything?
Well, I'll share a little bit about my experience too. Like Natalie, I was really unsure about the vaccine for a while when they were talking about it, but I think some of the office staff knows I did get COVID in November. I was being super safe, really safe with everything. I was not leaving my house. I was actually expecting a baby through most of the pandemic. So just trying to really avoid people. And my husband was going to work and brought COVID home. So that was like, no, I need this vaccine. As soon as I can get it, I'm going to get it. And I was able to get it in mid-January. And just like Jim, I had no side effects. I actually got there and I got pretty emotional because it was so scary to actually have COVID with a baby at home, because as Jim said, of the long-term effects in children, we just don't know what things are going to look like. And as a first-time mom, it was just really scary. And I was there like so excited to get this vaccine and felt nothing. After got the second dose, felt nothing. It just, right now I feel safer. I saw some of my Tender Rose people on Saturday because now we're vaccinated and we can actually be around people again. So just, it was a really positive experience for me. I feel a lot better about where things are and about my child being around myself. My husband has gotten the first dose. He's a giant baby and scared of needles, so I'm sure he's going to be bedbound for 2 weeks, but we're ready to be safe. And that's kind of part of what we need to do to make sure that we're keeping ourselves safe, keeping our daughters safe, keeping our family safe as much as we possibly can. And I just want to make myself available for anyone on this call that has not gotten the vaccine. I think some people on this call have already gotten the vaccine, but if you need help registering, reach out to me. Let me know if I can help. I partner up with Leisani and the schedulers and the staffing managers at Tender Rose to be able to schedule you guys. Kaiser is vaccinating members, as Colleen said, but also non-members. So if you don't have Kaiser through Tender Rose, definitely reach out to us. We can help. People in my family have gotten vaccinated through different counties because of the regulation. So if you need any more information, I want to make myself available for you guys to help get registered and get the vaccine if you're interested.
I have a question. I believe it's free, right? It's free everywhere, is it?
It is free everywhere.
Yeah. That's huge. Yeah. And Amanda, thank you very much for sharing your story, Caroline. I know that must have been really scary to have COVID, and what a relief to have your vaccine. Yeah. How about you, Amanda?
Yeah, I don't think I have any questions. I thought you guys did a great job kind of going through some of the major, I think, concerns and, things that make people a little on edge about getting the vaccine. I was not one of those people who was hesitant. I was, as soon as I could sign up, I was like, I want this thing. I've been waiting. And the first one, I didn't have any side effects from. The second jab, I definitely felt, kind of like I was coming down with the flu. But having done some research on it, I knew that was my body kind of kicking itself into overdrive to fight off this thing if I were to get it. And so that was pretty fascinating, just to sort of see your body respond, scientifically to something that is there to protect us. So I don't know if anyone else has any other questions. Like Caroline said, you know, she's there, all the care coordination team is there. I'm there to help. So if anyone wants to reach out after this and has any follow-up questions, we're here for that too. No?
And I would just
Absolutely.
like to extend an offer that if anyone, you know, gets the vaccine and wants just a check-in, we're willing to do that. I've promised that to a lot of MCPs in Marin that work with my clients. Just, you know, to have that extra support. You know, maybe you want to know, okay, Natalie, I'm getting a fever now, and Natalie's going to say, yes, you're getting a fever. And, you know, let's do something to help with that. But if you need that, we're open to doing that for anyone. So I know that I had coworkers checking on me and vice versa. So just to extend that out to everyone.
I've got a question for our care management team. We almost all of our clients have gotten vaccinated. Like, have we seen any bad side effects for them? I mean, like, what has their
goodness.
experience been?
Yeah, so I can talk a little bit about that. So I'll specifically talk about a case with 3 siblings. They're all in their 90s. And the only thing that we saw with the sister is just a little fatigue. And I think a little fatigue for someone that's 90 and you know, it has advanced dementia. She's otherwise pretty healthy, was actually pretty good. Her 2 other brothers had no side effects. And I've actually seen that with most of my clients, that we might see a little tiredness. We might see a few things that might be a little off baseline. But again, if you know that your client just had the vaccine, I think that helps us understand better what's happening with them. But no, they've actually been luckier. I don't know if it's because their immune systems are a bit older than ours, but no, they've all done well. They've all done really well. So.
Yeah, I can
Yeah.
speak for one client who he just got his vaccination on Monday. He's kind of clearing over the edge of the symptoms after 48 hours. And he didn't, other than just feeling a little bit tired and some arm pain, definitely. If you haven't gotten your vaccine yet, you're going to feel some arm pain at the injection site. That's all he experienced. So everything so far is smooth sailing, and I'm knock on wood there. But yeah, that's my experience so far.
Yeah,
Thank
same
you.
for my clients, just fatigue. Fatigue was it. And it was under 24 hours for each of the clients that experienced fatigue and no fevers. So very nice, very well. They handled it very well. Did you have something to say, Jim?
No,
Oh,
you've answered all my questions.
okay. All righty. Well, thank you all for joining, and I think for all my coworkers who are here as well too. And again, if anyone has questions, call us, call the office, and if you need help getting a vaccine and setting it up, again, we're here to help, and we want to assist you as best we can.